Caitlin. What do you do?
I'm Ceri. I work in a research lab at the University of Manchester. So I've done 6 years so far in this research lab, and we're focusing on lung disease. So one of the lung diseases we look at is cystic fibrosis.
So obviously I know about CF, but how would you define it as a scientist?
As a scientist, we see it as obviously a really huge biology problem that ultimately stems from a genetic mutation which causes an ion channel to be faulty, and that faulty ion channel means that what we end up with, especially when we're looking at the lungs, is this build-up of this really sticky, thick mucus, which is one of the major features, as you will know, of cystic fibrosis.
But why do we have the mucus there in the first place?
So yeah, in a disease like CF, the mucus build-up is a huge, huge problem, and you'd wonder why we've got it there in the first place. But without it, we wouldn't be able to survive at all. So what it does is it creates this protective layer in your lungs. So basically, when you're walking out and about every day and you're breathing in air, that air has got things in it that you don't want to get into your bloodstream, and that mucus acts as a protective barrier. And it's also slightly sticky, and so it can stick bacteria and bugs to it. And what happens is that mucus gets transported by the tiny hairs on the cells of your airways called cilia. And it's like a big escalator. And those little hairs move that mucus up. And without you even thinking about it, you'll be swallowing it or you'll cough it up, and it just clears your airways and keeps them really, really clean. So that mucus is absolutely crucial, and without it, we wouldn't be able to survive at all. And it's not just in your lungs you find it everywhere, in your nose, your ears. Anywhere the outside world can get into contact with your insides, you've got a layer of this protective mucus.
So are there ways to get rid of the mucus if you have too much?
In a person that's not got cystic fibrosis, we can get other illnesses where you make too much mucus, especially in winter when people have got a common cold, and you build up loads and loads of horrible snot, and you can cough it up, and it's really horrible. It makes that horrible rasping noise, but your body will respond to having too much there. The issue is when it gets completely overloaded. So in cystic fibrosis, there's no let up. There's no moment where you're making too much and then you're making less of it. You make the same amount. It's really, really dehydrated. It's really, really sticky, and it sticks to your cells, which means those tiny little cilia have got no chance of moving it. So that's why, as you will know, you have this very strong kind of physiotherapy regime to try and get that mucus out of your airways. So some of the research we're doing is looking at actually breaking up that mucus, so to try and get rid of some of the stickiness and make it that little bit more watery, so that you can actually get it out of your lungs.
But why is the mucus bad for you if you have too much?
So there are a number of reasons why it's bad for you. One is that because of so mucus is made up of molecules called mucins. It's a massive mixture of stuff. To everybody it just looks like a sticky mess, but it's quite organised. And if you imagine really, really long molecules covered in sugar, that sugar's sticky, okay? And that sticky sugar can attract bacteria. So what happens is you make too much mucus, it stays in your lungs, the bacteria stick to it, so instead of you getting rid of it and cleaning out your lungs, you end up with a lot of secondary bacterial infection, because that bacteria can live on that mucus because of its sugars. The other obvious reason that having too much mucus is really bad for you is that it can actually block your lungs. So, I mean, your airways are obviously arranged a bit like a tree. If you imagine a kind of piece of broccoli, where it all goes outwards down to the very bottom where your gas exchange occurs. But in your large airways, they have to be clear for you to take that oxygen in, okay? And if the oxygen can't get in, you can't breathe properly, and that mucus can really cause a massive plug. And you see the same in severe asthmatics have the same condition, where they have these mucus plugs in their airways which can stop them from breathing.
So how long does it take to see these effects?
Well, it's very variable from person to person, and it's very variable between everybody's conditions. So if you take a whole panel of people that have got CF, how much mucus they make will vary, you know, from day to day, from the time of day that they get it. So some people are worse in the morning, some people are worse at night. As a scientist, we don't really understand why that is, and there's a lot of other factors. So your environment can cause mucus secretion. If you breathe something in, you'll get a natural trigger which will cause you to secrete a lot more mucus, and that can add to it. So that's something that we don't really understand at the moment. One of the things that our lab works on is trying to understand what it is that makes up this mucus, how it's all compacted together, and if there's a way that we can actually try and break that down. So even if you are making too much, we can actually make it so that you'll be able to either clear it from your lungs or that it doesn't block it in the first place.
Are you close to a way of breaking it up? Yeah.
We've got some quite, we've got some quite promising concepts actually. I guess the main issue is the variation between people. So obviously trying to find something that will affect as many people as we possibly can and help improve their quality of life. That's the real struggle. But the use of enzymes and the use of different chemicals that can be inhaled, because obviously with the lungs you can treat them directly with things like inhalers, much like an asthmatic person would take. So there are things that in progress at the moment, and there are labs across the world that are working on it to try and improve the quality of life. So hopefully that will be something that's, you know, not too far away in the future.
Okay, thanks.